हाँ जी मिसेस शर्मा, शुरू करें?
हेलो हाय, हेलो हेलो हाय। सारा दिन फोन पे रहती है ये कमला। गिरा 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 मेरा गमला।
मैंने बोला था ना।
की कहानी आज बरसेगा पानी। ओ पिंकी के पापा प्लीज प्लीज टेक द छाता।
प्लीज टेक द छाता भाई साहब, प्लीज टेक द छाता।
मैंने बोला था ना।
लाल पीला हरा नीला साथ में धुलाएगी, व्हाइट कपड़ों पे क्या रेनबो बनाएगी।
मैंने बोला था ना।
पिंकी बेटा लेसेस, डोंट मेक दोस फेसेस। याद आएगी माँ जब गिरोगी।
मैंने बोला था ना।
बिजली की है तार, भैया बनो नहीं स्टार। हाँ यस नो नहीं।
मैंने बोला था ना।
सबको दिया ज्ञान पर खुद का नो ध्यान। हुआ फीवर थकान, अरे अब तो जाओ मान।
मम्मा एनाजल
पी लो। वेक्टर-बॉर्न डिजीजेस जैसे डेंगू, मलेरिया, चिकनगुनिया और टाइफाइड से हाई फीवर होता है। इस दौरान कम फ्लूइड कंजम्पशन और इलेक्ट्रोलाइट लॉस की वजह से पेशेंट की बॉडी डिहाइड्रेटेड रहती है। अगर इस दौरान पेशेंट अच्छे से हाइड्रेटेड रहे तो वो जल्दी रिकवर हो सकता है।
मम्मा मैंने बोला था ना।
Good morning. To diagnose a patient, I've got three methods. One is history taking, second is general examination, and the third is routine CBC. I'm saying CBC, not those 80 blood tests which everybody goes on printing. CBC, routine blood count, urine, very important, and ESR with blood sugar. Blood sugar now by prick method you can do immediately. And ESR. I have practiced for 60 years, but from the first day of my practice, I had a technician to do all these tests. So it's worthwhile spending on the technician. You recover it very fast. Today I am going to discuss the value of history taking. History taking is, why do these patients go to the hospitals and spend 1 month, 2 months and not becoming alright, not being diagnosed? Because the weakness of the private hospital, where the patient spends 1,000, 2,000 rupees per day, The house physicians and their staff, they don't take a proper history. They have no time to sit down and listen to the patient. All investigations going on. And today I will show you that how from the history taking you can make a good diagnosis. And I will show you two patients where there was one symptom with a fever. Suppose there is fever. Now what is the cause of the fever? Associated symptoms. For example, it will be one symptom, it could be multiple symptoms. So I will show you two cases of multiple symptoms, two cases of single symptom. Yeah, let me start with the first case. Rahul is 18 years old, goes to the college. He started running fever. And बुखार तुमको जाता था ना, दिन में कितनी टाइम आता था?
3 बार.
3 टाइम.
Yeah.
3 टाइम मतलब
Morning, then afternoon, thoda, and evening.
evening.
Yeah.
And you used to take some tablet.
Yes.
What?
Dolo.
Dolo.
6.
Dolo is a paracetamol. You used to go away. Correct? So this fever continued for, where you send her when she comes? Yes. Continued for days and days.
Yeah, 1 month.
1 month.
Yeah.
1 month. 1 month. Now, as I told you, in the fever patient, important thing is other symptoms. Something else. Some symptoms. That every time he had this fever, when he got fever, he had one complaint, very important complaint, Mike. 2016, also you had, correct? You know, the first time he had the pain and fever in 2010, which lasted for 20 days. No, then in February this year, he had the fever, which lasted for 5 days. No diagnosis was made. But at that time also he had the same pain. Show the pain.
Yeah, shoulder, this part.
See, he is using the word shoulder. It is not shoulder. Show it again. What is this? This is trapezius muscle. This is trapezius muscle. And he is very sure about this complaint. Very sure. And when you had this pain, Rahul, that did this pain increase if you took a deep breath? Like that? It used to increase.
Yes.
It used to increase if you take a deep breath. So he had this no cough, no cough. So this was the only complaint, and I always said, in the fever complaint, we'll tell you what is the fever. So this means the right dome of the diaphragm, something there. Last Sunday I told you about amoebic liver abscess. In olden days, about 40-50 years back, any specialist, if he had gone, he'll diagnose like this, amoebic liver abscess. Superior surface. Because superior surface right lobe is common. And the first symptom is fever and pain here. Trapezius. That too has disappeared. I told you last time. Abscess has disappeared. So this man, that means, had some pleural thing. And X-ray aap laya? X-ray chest? वो जरा X-ray chest दिखाना. X-ray chest दिखाओ. So as usual, somebody might have thought of it and got an X-ray chest done. An X-ray chest normal. No, I'm going to, when I take an X-ray class again, I'm going to remind you this. X-ray chest in a patient where you suspect pleural pain, useless. 100% useless. ये दिखाओ. ये लगाओ जरा. ये लगाओ. 100% useless. If you want to exclude pleurisy, pleural pain in a patient, you have to ask for sonography, not an X-ray test. And this you have to learn. You see now, this is the angle. It's supposed to be the angle. And I always teach. All these years I have been teaching. The angle goes down. Of course, this is very acute, beautiful. This Now I am telling you that I can see that this angle is not as acute as this. See, it's going dipping like that. Here it's this much. It's not dipping there. Anyway, it was reported normal. Sonography showed fluid here. This is so often you find. And anyhow, his sonography showed fluid here also. And sonography showed fluid here also. Now see, this X-ray heart fluid person is normal. Slightly bigger in size, but the sonography showed pericardial effusion there, fluid, and plus fluid in the abdominal cavity, peritoneal cavity. So now, this is Leelavati Hospital, big hospital. You can't have wrong reports. But the only unfortunate thing to tell you in short, that they did the examination of the fluid, this, that, that's okay. See, they put him on treatment, this is tuberculosis. Now I want to write, when I take an X-ray class, I'm going to tell you how, when you have a polyserositis, fluid there, fluid there, fluid there, don't think of tuberculosis. Tuberculosis should not be thought of. The commonest cause of this little fluid is dengue fever, where you get vasculitis, fluid comes out, pericardial fluid, pleural fluid, ascitic fluid. But then small quantity, small quantity. When you have large quantity, some autoimmune disorder, the pericardial fluid, they went on following, and somebody saw a little calcium in it, echocardiogram. And then they told mother, तुम किधर गई? किधर गई? इधर इधर. हाँ, तो तुम क्या तुमको बोला कि हार्ट का क्या ऑपरेशन किया? क्या बोला वो?
हार्ट का वो पेरिकार्डियल थिकनिंग है.
इतना बड़ा पेरिकार्डियल थिकनिंग के सो मच. हाँ, थिकनिंग तो उसका
तो उसके लिए सर्जरी की जरूरत
पड़ सकती है. So she got frightened. And I told you that here, how that this, ये दिखाओ जरा, ये close up करो. See, he's absolutely no vein there, clean. The day he develops a constriction, which will be after a few months or years, they have not. Here, from there, I'll pick up like this, And the pericardial fluid, which they diagnose. Remember one thing, very often the sonographers are saying there is fluid in the pericardium. Normally you can pick up 10-20 ml, but moment you find little more than that. And pericarditis, when you have pericardium inflammation, when you want to auscultate, you have to put the stethoscope there, and you have to look for this sound. And the heart is beating, lap up. And the moment you have this, that is pericarditis. While in a pleura, if you have to examine that such a patient, turn around, remove hand here, you want to see that for pleurisy, not in the front, back. Remove this thing, and here is the base. Here on the left side. So you auscultate same thing, but after deep breathing. सांस ले हो, लंबा सांस ले हो, छोड़ो, ले हो. Not continuous. This is the difference. Otherwise, the rub is more or less same noise. He looks very healthy. No? 2 महीना हो गया?
Yeah.
2 months he was healthy. Means what? Means he can't be having a very bad illness and this and that. Some good illness. Good illness again comes to autoimmune. But lupus is famous, SLE, for pericardial fluid. fluid, static fluid, polysinusitis. Do you know in olden days, we used to see this plenty before sonography came, in olden days. These dengue tests were done 3 times, 4 times. Dengue is a short-acting virus. In 1 week you live or die. Nobody dies, hardly once in 100 people or 200 die due to this complication. But dengue will come and by 1 week you are gone. Yes, last week I told you that if you get a combination of viral A and E, then they can get a very high fever like this. You can get joint pains also. You can get fluids like dengue. Fluid here, fluid there, fluid there. That he was done. His hepatitis A and E both were negative. I have diagnosed him here as AOSD without joint pains. Adult onset Still's disease without joint pains. Why? I will not hear that because his ferritin was high and his leukocyte count was high. High leukocyte count without any infection somewhere. In all, say lupus for example, that he is a male, not a female. Young girl I would have talked of lupus. And his hair is so beautiful hair, my God, in that भाई मेरी में टीवी सीरियल लेक्चर उसका हम बाल दिखाएगा, वो लड़की वो बाल के ऊपर मर गई, हमेशा दिखाएगा. हाँ ऐसा हमारा. So lovely hair, skin, he has no rash. So lupus didn't fit in. And leukopenia. In SLE there is leukopenia. You don't get high leukocyte count. And I went through the report, ferritin actually was not done. Somewhere I have sent it, ferritin. 100% I'll show you. Ferritin will be high, and now we have got another interleukin 6 test, which is high in this condition. I'm sure it will be high. Reports are going to come tomorrow. 100% they will be high. So adult onset Still disease, where we steroids to start with, and later on I put him on methotrexate, HCQS, like rheumatoid arthritis, same, but along with steroids. And if he doesn't respond, then what? Father is a jeweler, so paisa to hai. Then I will give him tocilizumab, tocilizumab injection, 400 milligram every month intravenously for 1 year. That will make 40,000 rupees per month in 1 year, 5 lakhs rupees, which his father can afford. No problem. But I'm telling you, 99%. I brought on the first lecture. I brought another patient of AOSD. I showed you that boy. 99% he will respond to this simple treatment. The report will come tomorrow. Give him a big hand. Thank you. Namaskar. Thank you. Thank you, Ramesh. This patient of AOS, adult onset Still's disease, comes under rheumatism. It's a differential diagnosis of rheumatoid arthritis. So they have polyarthritis, high fever. They are main 2 symptoms. But arthritis would be absent, like in this case. There is no arthritis. But high fever, and with this pleural effusions, polysinusitis. When you diagnose this pleural pain, you diagnose pleurisy. You take a sonography, there is fluid. But then you confirm pleural effusion. Then what is the cause of pleural effusion? Opposite side also has got fluid. Then pericardium also has got fluid. Peritoneal cavity also fluid. So polysinusitis. Polysinusitis means no tuberculosis. And polysinusitis fits in all these rheumatic tail-like condition, like this condition, and where, of course, many drugs can be given, including ordinary NSAID group of drugs, etc. I put him on steroids for a quick recovery because he was suffering for 2 months, and there was a dramatic recovery. And I'll show you that interleukin 6 test will come down. This interleukin 6 is being done for last few years, and it's specific of this disease, especially adult onset Still's disease. Next. Rahul. Bring that X-ray दाखवणार तुमच्याकडे X-ray आहे का स्लाइड ते बघा थांबा एक मिनिट पहिला ही X-ray दाखव राहुल इधर आओ देखो उसको उधर दिखाओ देखो उधर देखो अरे अच्छी तरह सेंटर में करो ना उसको हाँ देखो हाँ good, no? For my TV series and all, I'm looking for heroes and all that. Voice will be mine, singing and all will be mine. Because these people can't sing and all. So I'm looking for heroes who are good looking, young, then I'll sing for them. We'll make TV serials. काम करेगा? So these chicks which you are seeing beautiful, they are artificial. And with a steroid. He's on 30 milligram of prednisone. And when he came, that X-ray देखा था, पहले X-ray देखा. He was so ill, you can't believe. Fever, cough, sputum, and look at the lesion. And cavity there. Huge. So, I mean, anybody will say it is tuberculosis. Yes, agreed. ठीक है, sputum was done, no AB, gene expert test was negative. Hinduja hospital was done. Now, when gene expert test is negative, should you still suspect tuberculosis? Maybe if I'm an academic man and if I'm suspecting tuberculosis, I'll still send for sputum culture up to wait for 6 weeks. But not if I am not suspecting. This man, if he had tuberculosis, he will come for walking nicely like this and say, बुखार आता है रात को, खांसी होती है, वजन कमती हो गया. This man was so ill, you can't believe. He was like a dead man. And he toxic, what we call as toxicity. When he came first time, he was absolutely, and he not only that, pains, joint pains. Then this arm was swollen, legs were swollen, painful, tender, which means deep vein thrombosis, deep vein thrombosis, deep vein thrombosis, deep vein. Any paper I made? No. Anything I wrote somewhere?
No, yeah. Yes,
So, here.
No, this is Gaurav.
No.
Yeah,
And then anemia, and then again his same story, ESR somewhere, this is ESR after treatment, 106 in the metabolism. That means in my clinic 130. Very high ESR, very high CD80 protein. CRP is a better test than ESR in a specific diagnostic specificity. That means, yes, his urine showed albumin. How tuberculosis patient, why should he have urine albumin? What has tuberculosis, pulmonary tuberculosis got to do with urine, kidney? Nothing. He had anemia, he had kidney involvement, and the creatinine was first time only when I remember was high. Microalbumin markedly, C-reactive protein 181, albumin 2.72, liver also affected. See, serum albumin is a very, very important test for chronic liver disease. And his creatinine was high, 2 point something again. So kidney involvement, liver, like that patient I showed you, all you have to see, patient comes to you and yes, accept it. You did a gene expert test. Because tuberculosis is very common, no? Once it is negative, don't go on following as tuberculosis. See, that is a mistake which happened in this patient. They went on doing In moment I saw this picture, 1 second, this is vasculitis. Vasculitis affecting all the organs, lung, eyes, kidney, liver, joints, veins, deep vein, thrombosis. And I asked for this ANCA, strongly positive. Finished, diagnosis over. Now the question comes, and there are types of vasculitis, large vessel, small vessel, polygyny. That I cannot go into details of those things. Where I like to, if somebody wants, a specialist can do. But I have to sort out this lung lesion. This lung lesion, दूसरा X-ray देखो. So I had to get a biopsy done of this lung lesion to show that this is vasculitis. So olden days we used to call Wegener's vasculitis. Now they have removed that name. They said we should use the word only vasculitis. And so a biopsy of that was done of that lesion. And what do you think? Again, as I said, unless you go on reading, no, you can't. The histopathology of Reliance Hospital, top 7-star hospital. I send all my patients there now because I'm near, my clinic. I know most of them, they're my students, and they're very nice, very good hospital. But everybody is not good. The histopathology is what she did. See, when you report histopathology, you must see first the clinical diagnosis, very important. And then write in relation to your clinical diagnosis. So we said vasculitis, she should have written in relation to vasculitis. The biopsy shows this. She didn't do that. She wrote down it shows multiple granulomas. Granuloma means tuberculosis. I mean, tuberculosis is one of the causes of granuloma. So she wrote down vessels, whatever vessels she saw, there was no vasculitis. So she said final diagnosis tuberculosis. Now when she said tuberculosis, that same tissue was sent to microbiologist. Microbiologist said gene expert negative. But she said I must do culture. Culture for 6 weeks. These poor people, they have to listen to, they Shabify them, I made to wait for 6 weeks before we tell you because she had written on tuberculosis, histopathology. And I was getting irritated because I knew spot diagnosis. I said, I'll put him on steroids and cyclophosphamide and give some LMW heparin for his deep vein thrombosis. He shouldn't die due to pulmonary embolism. And I was trying to ring up this histopathology. That Wegener's, when initially the disease was called Wegener's. What was the full name? Wegener's granulomatosis. That means in the biopsy of the lung lesion you see granulomas. But enough vessels may not be seen in a CT guided biopsy. So if you want to see vessels, you have to do open biopsy, open lung biopsy. So she should have seen the clinical diagnosis. She should have seen these granulomas are compatible with Wegener's granuloma. This is how she should have written. Then the microbiologist should have clearly said negative. Gene expert negative is no tuberculosis. We would have started the treatment immediately. They didn't do it. I mean, even if they come to me, I would have started the treatment. So poor fellow lost 10-15 days in this. When they come, I got very angry. I said, this is vascular. That woman doesn't know. She doesn't read, I think, that you get granulomas in this condition. So I said, we start the treatment. Steroids, cyclophosphamide. Look at the way in which he improved. You can't believe it. Unbelievable. जब भी तुम मेरे पास आए तो इतना हो जब भी बीमार थे ये थे तो दवाई शुरू करने के बाद कितने दिन में तुम एकदम फर्स्ट क्लास एकदम चलना फिर
मुझे 1 महीना
हाँ 1 महीना naturally this is not a dramatic thing like that other one patient here there is no therapeutic test in this condition there is no therapeutic test but response within 1 month this man कितना वजन बढ़ गया 1 महीने में 11 kilo weight he put back, put on. Anemia improved, kidney is improved, lung is improved. So, दूसरा X-ray thing show that it's becoming localized, and I'm sure, but it'll take time because he'll need treatment for a few months. And see, it's improving. It's improving. But otherwise, it's like tuberculosis. Anybody say there is TB? Not TB. This is vasculitis. Just to tell you, give me a big hand for coming. Thanks. Thank you. Thank you. Thank you. Vasculitis is a new terminology for last few years. Vasculitis can be used for so many. Polymyalgia rheumatica has got vasculitis. So many other diseases have got vasculitis. Vasculitis of the aorta, big, small vessel, big vessel. It's a very big topic, subject, and never treat these patients. Diagnose them and refer them to a specialist. Because in this condition, symptoms are multiple symptoms, as you heard. And I suspected it much more because ESR was more than 100. With a more than 100 ESR, it fits in very well that this was, and not only that, I asked for routine urine in every patient till now 60 years, because you will be surprised how often the urine is. And nowadays these laboratories are doing 80 tests, 70 tests for 700, 800 rupees. Urine is not included, CVC is not included, ESR is not included. While in private practice, these are the three most important tests. The CVC, in this patient, anemia. You can't get anemia in a male patient. No, not allowed. Unless maybe he is on aspirin or NSAID group of drugs, or he has a family history, thalassemia minor. So anemia, raised ESR, and the symptoms, diagnostic of vasculitis. And the only test which you have to do is this ANCA. You do ANA in the beginning. ANA is positive vaguely in all rheumatic disorders. Anti-DNA if you are suspecting lupus. ANCA, ANCA-C, ANCA-P, etc. if you are suspecting vasculitis. So vasculitis is a new terminology, and there is a lot of immunology attached to it. So much so today the modern rheumatologists are also known as immunologists. They should be very good in immunology because they are supposed to diagnose immunological diseases. So these patients, multiple organs affected, kidney can go into failure. Never treat them, keep them as your patient. Diagnose them, send them to a specialist. And before, how will you diagnose? Confirm? Steroids, I told you. Steroids, sometimes with cyclophosphamide, you give, symptoms disappear. Now you don't treat, pass on to a specialist because he needs it for years together. This patient had sinusitis, for example, other infection anywhere else, 3 operations were done. So this is the story of vasculitis. Very easy to diagnose if you remember multiple symptoms, fever, raised ESR, markedly raised ESR. Next.
Yeah, another very nice patient here. First, I think he should be shown. No, किधर है रियाज? किधर है? 55-year-old. अस्सलाम वालेकुम. तुम रियाज के लड़के हो या तुम रियाज? मैंने समझा तुम उसके लड़के आ गया. हाँ. So this hero, रियाज पहले इधर दिखाओ ना. Screen, show him. 55 years old, and he came for PUO, pyrexia, fever of 3 months duration. And वो तुम्हारे वो चाचा किधर थे? वो अपने भाई किधर? वो जो बोलता था हॉस्पिटल में रखो, कि वो किधर? बोलो 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 बोलो. कौन? मुजीद. हाँ मुजीद को भी देखा नहीं इधर. And he brought him in. He was pestering me all the time, and that उसको हॉस्पिटल में भर्ती करो ना. हॉस्पिटल में अस्सलाम वालेकुम. हाँ मैंने बोला इनको इधर शक्ल देखने दो, इसकी शक्ल भी दिखाओ, इधर दिखाओ इसको मुजीद की. क्योंकि ये हीरो हमको बोलता था उसको इधर हॉस्पिटल में. हाँ वाह, हॉस्पिटल में रखो ना उसको. Hospital. And then when I found out He went to a Prime hospital, then he went to Prince Ali Khan hospital, then he went to Apollo hospital, then he went to Mamta Nursing Home, then he was admitted in Wokhard hospital, then Prince Ali Khan hospital again, Global hospital. He brought him admitted. Then I told Mujib, अचार डालने का उसका हॉस्पिटल में भर्ती करना किस लिए? For what? The public is now somehow have been thoroughly spoiled. They think for any illness you should admit in the hospital, and hospital you get nosocomial infections. That's the trouble nowadays. MDR tuberculosis you're going to get from hospital now. In future you will just see, and all other infections you get. And now here is a man where I found that when I dictated to my secretary, he had anemia. I told you that in a male patient you can't get anemia. Sorry. He had severe anemia. That means one. Then he had leukocytosis. That means leukocyte count was abnormal, but he had no leukemia. Then he had very high ESR again, just like that girl. Very high CRP. See, very high. These are pointing towards autoimmune vasculitis, and person having generalized symptoms, Then he had abnormal liver function test, abnormal kidney function test. That means this is autoimmune something. ANA was positive. Hepatitis C was positive, where he had some blood transfusion. वो खून का भी चढ़ा था तुम्हारा कितने साल पहले? 14 साल पहले 84 में एक्सीडेंट हुआ था. But hepatitis C, when it remains in the body, more likely to develop autoimmune disease. And then I got this test done, P-ANCA, which is positive. So P-ANCA, ANCA tests have come now. Do you know how costly is this test? P and C-ANCA together, 3,000 rupees. See, I'm now watching, why doctors have been missing all this? I don't understand. Why? Now P-ANCA, C-ANCA are done by immunofluorescence. Again, immunofluorescence is one method of testing. But people who do by ELISA is a bigger machine, more costly machine, so more accurate machine. So they report, they don't do this, they do a PRO and MPO, PR3 and MPO antibodies. PR3 and MPO is same as C and P antibodies. They are more accurate. So, and I can spend more money. I am watching my diagnosis. So now that patients are coming, I am sending for MPO and PR3 antibody, ANCA. So ANCA, so when you have got ANA positive, ANA is general for the whole group. If ANA is positive, then you do anti-DNA. Anti-DNA is for lupus. Lupus, same thing. It works, but female patient. Should be female patient. If it was a female patient having same thing, I will first suspect lupus. And some skin, see, he doesn't have any skin problem. Otherwise, same thing can be in lupus, same story. With male patient, I suspect vasculitis, get a blood ANCA done, positive, this is vasculitis, finished, diagnosis is over. Now what happened? Mujib had irritated me. I told him, I said, तुम stage पे आना, मैं दिखाऊंगा जरा हीरो का, देखो सीधी कलर वगैरह वगैरह कैसे. I said because he irritated me, hospital में भर्ती करो, hospital में भर्ती. I only told that his relation, I said you put him on steroid omnocortil, 20 milligram per day, and he has to come for my lecture. Promise, he'll come for my lecture. He is on 3 months. He's got fever, he's got this joint pain, he's got this, he's got this. He will come walking. You see it. See the therapeutic test, this is called a therapeutic test. Our therapeutic test is, no, this you can't have in all other illnesses. You can't do this in tuberculosis. You can't do it in so many other illnesses. But in these illnesses, like this, I had guaranteed, I knew he will come on the stage. 3 months, he was so bad and no appetite. You know, दवाई लेने के बाद खाना इसका कैसा हो गया? बहुत अच्छा हो गया. अरे इधर बहुत अच्छा, तुम बोलते हॉस्पिटल में क्या
खाना उनके दवाई लेने के बाद में खाने लगे तीनों टाइम,
खाने लगे, चलने लगे, सब बुखार गुम हो गया,
बुखार भी गया, सुस्ती चली गई, थोड़ा वीकनेस भी कम हो गया पूरा उनका।
पर तुम तो बोलते थे हॉस्पिटल में भर्ती करो,
तो ऐसे
हॉस्पिटल में फिर हॉस्पिटल में खाना भी ठीक नहीं देते ना। द हॉस्पिटल फूड आल्सो men like him, you won't get here home food you're getting, beautiful food you're getting. So here you see what I am trying to tell you is when you find a patient with this diagnosis is so easy that spread out disease, different systems, 3 months fever, he goes to 10 hospitals and then PET CT scan, that misguided. See, he had some inguinal glands here, which number of people have got inguinal gland. Now in PET CT scan they became hot. They were reported as hot. Hot means disease. Disease in 3 months fever means lymphoma, cancer. So somebody did a biopsy in one hospital. It was negative. He went to second hospital. They said, no, we'll again remove the whole gland. This must be the cause of fever. It's hot on PET CT. Again normal. PET CT doesn't mean you get 100%. It's positive in any chronic inflammatory gland, tuberculosis gland, cancer. Everywhere it is hot. So it only gives you some idea. Make sure. You have seen? Enough. Now continue. Look for something else. बहुत शुक्रिया. Give them a big hand to Riyaz, Hero and all that. And Mujib, आगे से मुझे हॉस्पिटल का नाम मत बोलना. बहुत हॉस्पिटल हो गए. शुक्रिया, बहुत शुक्रिया. खुदा हाफिज़.
Here, this is the second case of vasculitis, and it's just like before, as I told you, multiple symptoms, fever, joint pain, body ache, loss of appetite, etc., and multiple organs affected. Urine was abnormal, everything. The blood count, the ESR was very high. So I asked for ANCA test, positive. And the response was so dramatic. But even then, don't treat these patients because their illness is going to last for years together. Kidneys could fail. Pass them on to a specialist. But when you give steroids and they become alright, you get a terrific publicity. That how a GP diagnosed when the patient was in 7-8 hospitals. The explanation is in those hospitals nobody takes the history properly and nobody does the general examination properly. I told you 3 things to diagnose: history taking, general examination, and CBC, ESR, routine urine. And these people need a long treatment. Don't keep them as your patient. Refer them to a specialist. Next.
Very sorry. Very sorry. See, I mean, I get fright. I feel some hero has come. You see, when he enters, but he is not a hero. He is an executive, but looks like a hero. In the usual short hair nowadays is a fashion, and see the rimless glasses and this striped shirt and beautiful handsome man in BMW and all driving, so and everybody will be looking at. The difficulty of this man is this, that he cannot be. I'll tell you, the test which I wanted, I was not sure he'll get it done. But you don't know when he'll be in Bombay. Just now, 10:15 he is here. In the evening, 8:30, you don't know where he'll be. Bangalore, Madras, here, New York, somewhere. This young generation, when I see, tremble, I don't know what is going to happen in the future. This man travels hell of a lot. He is Europe, he is that. And he developed fever. Now it's very interesting. It's a common fever. I don't treat common fever. Because he was my patient, earlier he was my patient for some health checkup only. Cholesterol, this, that, correct?
Yeah.
But because he got fever, he came to me for fever. And now I must ask you associated symptoms. I told you all fevers diagnosed by associated symptoms. That time when he had fever, as far as I remember, first he had a little cold and sore throat. Did you have cold, sore throat?
Yeah.
you must remember it, huh? Note it down. Cold and sore throat can cause fever, yes, but that fever cannot go on for 8-10 days, 10-12 days. Your fever by the time we're doing testing was 2 weeks old.
2 weeks.
2 weeks old. You can't do it. So even tonsillitis, but for tonsillitis means then again there should be no cold. Tonsillitis, today I'm going to show you before you go home. I'm going to again show you the slides. Tonsillitis means fever, pain, glands here. Finish. No susu cold, no bad throat and or no. Tonsillitis means only that. So obviously there is no tonsillitis, but he had some sore throat, a little cold, but 2 weeks fever doesn't fit in. And then he developed some other symptom of the neck. Where was the pain in the neck?
So initially the pain was here.
Initially the pain was there. Just see, huh? Yeah, then what happened?
Then I think it moved down to somewhere around here after like 4-5 days.
And when this pain came, that time was this pain, did it come when you're eating, when you're swallowing, when you're bending, when you're, or was it pain hurting when you pressed?
No, it was a little bit of swallowing.
Swallowing.
And whenever you stretch the neck, you would
stretch
feel
the
that.
neck, will get the pain. You had no other symptoms, huh? And by this time it was 2 weeks fever, huh? 2 weeks fever. Now 2 weeks fever, you see the differential diagnosis, PUO. For a minute when he came, because he is such a busy man, and I told him we'll hospitalize you, investigate. Then again I said, no, okay, we'll try to do without hospitalizing, because his health was otherwise very good. By the time he came for this 2 weeks, we noticed, because weight, my secretary takes weight every time, he had lost how many kilo weight? 4 kg.
4 kg.
4 kg. No, 4 kg weight to lose in 2 weeks. Not possible. And otherwise, in a healthy man, he was still traveling, eating, everything. He had a tachycardia. Now tachycardia. So I said, this is thyroid, tachycardia, loss of weight, thyrotoxicosis. And the blood test was done. TSH was down. TSH markedly down means thyrotoxicosis. Hyperthyroidism. Now I made the diagnosis, ESR done in my, ESR I have kept there. Every lecture you will find that ESR. In my next 2 months you will see that machine every time. Just to put in your head, such a simple machine, cheapest machine. ESR costs you nothing, zero. And look at the information he gave. His ESR was high. I said, this is subacute thyroiditis. And I am telling you that all the commonest cause of hyperthyroidism, I am now seeing in the practice, is not Graves' disease. So all what we used to teach in the past in the books, what they were mentioning, Graves' is rare. It's not common. There the eye signs are so much and all, and again in the blood you must show anti-TSH receptor antibodies. You can't diagnose with Graves' disease just like that. So now to confirm my diagnosis, I had to send him for thyroid scan. Otherwise my diagnosis is not confirmed. Otherwise I am only said hyperthyroidism. Because if it is hyperthyroidism, if it is for example Graves' disease, if it is some nodule there in the thyroid which is hyperactive, then the isotope must be picked up and thyroid should be dense, black. But if it is subacute thyroiditis, in spite of the blood showing hyperthyroidism, the thyroid will be blank. This is 1 second diagnosis. So for this diagnosis, he should be present in Bombay for doing a thyroid. Nuclear medicine appointments are difficult to get. First of all, nuclear medicine departments are very few in whole of Bombay. Then to get an appointment, then to go for thyroid scan. So we were after him like hell, because without that we can't confirm the diagnosis. And if we can't confirm the diagnosis, he has to do. And fortunately, he got time. He went for thyroid test. Nothing, no isotope in the thyroid. There is no other condition except subacute thyroiditis. And He's very intelligent man. By the time he had read Google and all, he could have asked me 100 questions. But he trusted me. He trusted me. He didn't want to throw so many questions to me, and he trusted me. And for treatment. So I told him also. I said, no, his pulse was fast. I gave him beta blocker and some paracetamol. And I told him, you want me to give you steroids if you want fast? Otherwise, we'll give nothing. You will be alright. But it might take few weeks. He agreed. He said, no steroid. He said, no steroid.
Yeah,
we didn't give it. No steroid. And the whole illness, how many days it took for the whole thing to come down?
So I think from Feb were the symptoms, March beginning we diagnosed, and I think by July the thyroid came back to normal.
3-4 months. Now this is the story of subacute thyroiditis. The patient will come for fever and initial sore throat. That same virus is supposed to be a virus. So he had initial cold and there was sore throat, virus. But then when the fever continued, pain started. This was thyroiditis. Diagnosis by blood test and thyroid scan. It is supposed to be rare in the past. Why rare in the past? People didn't do the test, no? You must be missing. Because unless you do a thyroid scan, you can't confirm the diagnosis. So, Amit became normal weight. You put on your 4 kilo weight, you put on soon. Fever disappeared, everything alright. Now I told him, if you follow up this patient, they might go into hypothyroidism. If they got very high antibodies, you had high antibodies? No. Antibodies we did your TP.
They were a little high.
Little high, but not very high.
Not very.
So if they were very high, then more chances that in the next 2-3 years he'll develop hypothyroidism. They were not very high. He is ready for that to follow up. And then what happened? Last month I had this patient from who was admitted in Bhatia hospital, a big hospital. He brought so many reports and he brought discharge card of Bhatia hospital, where he said he was under some senior physician. The discharge card said, final diagnosis, PUO with hyperthyroidism. PUO with hyperthyroidism. I saw this. I had made the diagnosis. I told him, sorry, I think let me call my young man who is better than me, who should diagnose. Sure, my secretary rang him up. He was going to the office. Amit, please come for 5 minutes. Doctor wants to see you. And he has got his beautiful car now. Zoom, he was there, early morning there. So I called him inside. Amit, I told them, Dr. Amit, just full name. Dr. Amit, he is my junior man, but very intelligent guy. So I let him make your diagnosis. I said, Amit, this fellow he spent 2-3 lakhs rupees in Bhatia hospital. This is his diagnosis. PUO with hyperthyroidism. What do you think is the diagnosis? Subacute thyroiditis, he is saying. Subacute thyroiditis. So the patient absolutely started doing. Thank you. I said, go. I examined the patient and I told him, you got subacute thyroiditis. Because the condition with fever, with hyper, but now how will you confirm this diagnosis? Am I right or wrong? Thyroid scan. And some hospitals like Bhatia hospital have no nuclear medicine department. They have no nuclear medicine department. How will you confirm? You can't know. So I had to send him elsewhere for a thyroid scan. Of course, it was 0. There was no uptake of the thyroid with hyperthyroidism. And that combination is subacute thyroiditis. Please give him a big hand. And he was waiting here for 2 hours. 2 hours. Thank you, Amit. Thank you. You can go from there. Yes. No problem. Thank you for coming. Huh?
No, absolutely.
Yeah. Thank you.
Subacute thyroiditis is not a very common condition. But I wanted to show you as single symptom, one symptom and fever. And it's a very peculiar case. Patient has got hyperthyroidism, but he is running fever. This combination, diagnostic, always you must do a thyroid scan. And these people recover by themselves and all. Next. Hamida, come. Hello. How are you? Assalamu alaikum.
Walaikum salam.
Hey. I have an extra interest in her. Because you're not बोलने गए ना, you're not forgotten ना. आपने जो promise किया बोलने गए ना, K&K?
Yes.
Huh? K&K. This one picture had come, key and cover. What is it? Key and ka. But now it seems that she is a good singer, and I am also a very good singer. So I told her, when I make my TV serials after 2-3 years, all the male singers, heroes will be my voice. But what about the duets? Who will sing with me? So she has decided that she will sing with me. So by that, another 2-3 years, I'll be 87 years old, you'll be 18 years old. There'll be another record. That a duet sung by 87 and 18, hit. We'll go hit. And now, Hamida, pardon?
Khan and Kapoor always.
Khan and Kapoor. So it'll be K&K. Kapoor and Khan, K&K. Now, I want you to tell them that those 5 months when you suffered, no. Yes. You were having complaints, only 2 complaints, as far as I remember, unless I've forgotten. And your 2 complaints were cough and difficulty in breathing.
Yeah.
Correct? Don't become nervous. They are all Sadhu doctor there, nothing You had cough and difficulty in breathing, correct?
Yeah, correct.
2 complaints?
Yeah.
But the cough, this was going on for 5 months. In the last 2 months, keep it here. Last 2 months, they were so much that at night time, you could not sleep. They will come at night, correct?
Yeah,
Cough
correct.
will come at night.
Yes.
Difficulty in breathing will come at night. Sometimes once, sometimes twice. You will get up from sleep.
Yeah.
So with the result, 2 months you have not had a good sleep.
I used to get bouts of coughs.
Bouts of cough.
Yeah.
Will wake you up.
Yeah.
And when you wake up, then mummy will also wake up.
She did not sleep for almost 4 months.
Pardon?
She did not sleep for almost 4 months.
Almost 4 months she didn't sleep. Because of the complaints. It's all. Anyway, in short, what I want to tell you is this, that she was suffering like that. She is a very clever girl. She can go to the school regularly. And this should not happen. You know, I gave her the rescue course. Rescue course. What is called rescue? Rescue means what? Somebody is drowning, you want to save. You save his life, you have rescued him. No? So we use the word rescue course. So next Sunday, we are starting the lung. Next Sunday, no? Next Sunday is lung, yes, correct. So next Sunday I am going to tell you about this. What is the rescue course when you start with these steroids? And in a large dose, taper off. And when Vinay is not coming, no? And I was telling her when they came that day, I said, see, whether you have suffered so long, you have not slept for 2 months and all. I was just fooling her. I said, see, next 2-3 days, 4 days, you will have a beautiful sleep. You will not get up in the sleep, no cough, no breathing, no problem.
It did happen. As he said. It did happen as he said.
It did happen as I said. How? That anybody should be able to do it. All doctors should know what is called a rescue course. See, the cough and difficulty in breathing is a bronchial allergy, rampant. In Bombay, it's rampant. It is not important. It is important that the life should go on as normal. I mean, it's a shame that a girl like that not to sleep for 2 months. And when you start within 2 days, 3 days, it's finished, normal, sleeping. I have not cured the allergy. Remember that. The cough and dyspnea, she has to live with that. That is a problem to be solved later on. Maybe I will advise her that, Khan's family and all that, ऐसा ठीक है, अभी 2-3 साल हो गए, and she is 18-20, उसको लड़का देखो, ऐसा लड़का देखो जो कनाडा में होएगा तो अच्छा है, ऑस्ट्रेलिया में होगा तो अच्छा है, अमेरिका क्यों? Because if you change the climate dramatically, the disease disappears. But I can do this for her. For every patient I cannot suggest that, no? But she fits in that. We have got some possibilities which we haven't got for everybody else. That is a different problem altogether. First she has to have a good sleep, she has to study, she has to pass the exam. And the day she started the rescue course of 40, I gave her only 40 milligram. I could have given 60 milligram. What's wrong in that? Because her weight and all is quite good. I could have given her 60 milligram. No problem. I gave her only 40 milligram. Usually I said to reduce from the next day. In her case, I said to take it for 2 days, 2 to 3 days, because she's long lasting. She has 6 months, the whole thing has not responded. And there is nothing to confirm there is no blood count will tell you the diagnosis, no peak flow, no X-ray will show the diagnosis. It's a clinical diagnosis, simple. That a patient is coughing, what night she goes on coughing, she gets spells of breathlessness. From the day I said, told her to start the rota cap. You started the rota?
Yes, I started.
Now you are taking it how many times a day?
2 times a day.
Why did I start rota cap from the first day? Why? Rota cap has got the same disease, same drug which the prednisone she is taking by mouth. Rota cap I have started so that she gets used to she will know it is due to that she is responding. And she will agree to continue that for 1 year, 2 years, 3 years. I would know that day I might treat her for 6 months. Maybe 6 months. Maybe she's already got complaints of 6 months. And for 2 years, I would know. She'll have to be on steroid inhaler for 2 years. I would know 2 years. The later they come to you, the longer the illness of this. If she had come to me for 2 weeks illness, I would have possibly even for 3 months, 6 months, finished. Because she has come so late, all this. So, this is just to show you what is the value of it. When do you use a rescue course? And within 2-3 days, she was all right. She has been going to school, she studying, she sleeps well, and this is taking regularly, yes. Morning, evening. And the tablets have stopped now?
Yeah, they've stopped.
You come to half tablet or something?
No.
Stop. And no attacks, no cough, no difficulty in breathing attacks.
No attacks.
This is the management of a severe bronchial asthma. I've done nothing, no other medicines. Huh? The only that rescue course tablet and inhaler, nothing else. Most of you give those 10 medicines, that cough syrup, terifalin tablet, that tablet, I don't know. How many medicines, for what? She needs only inhaler, but inhaler you can't give her. Inhaler is for maintenance. She needed rescuing, she was drowning. So I have rescued her in the rescued course. She's continuing her inhaler. Finished. That's her treatment. I put on glasses. She'll put on this. My glasses sometimes glass number can disappear. Her number also can disappear. And I'll make it disappear by finding a boy in Canada. She's got already somebody in the Canada now. So now, before you go, you have to act and sing with me, So I think let us, we got 5 minutes, 2 minutes, test your voice and all that. No, you have to, let's see how will it say. भंवरे की गुंजन है मेरा दिल, कब से पुकारे है मेरा दिल, के लिए ना ला 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 ला. Now let's see your voice. Otherwise, they say no, then I'll not take you. Come on. No, not any. I want to test the voice. I want to. Shall I take her because I might cancel you? But come on, quick. You will not get a chance like that. All useless people sitting.
Yeah.
You know nothing about the music. वो डॉक्टर लोग को म्यूजिक का कुछ आता ही नहीं.
Just two lines.
Two lines. Come on, quick. But hold it properly.
हीर हीर ना खोड़ियो मैं तेरे साहे बांधोई कुड़ी लखिया वेल जाए कुड़ी लखिया वेल जाए हो मैनू ले जाए मिर्जा कोई ले जाए मिर्जा कोई ले जाए मिर्जा कोई हीर हीर ना खोड़ियो मैं तेरे साहे बांधोई कुड़ी लखिया वे ले जाए.
हो गया. Thank you.
I want to thank Dr. Saab for like making my daughter like same as she was before, because I used to feel very bad seeing her coughing all the day and night, and we went to many doctors, many pediatricians, but somehow she wasn't cured, and Allah subhanahu wa ta'ala has really given shifa to Dr. Saab, that he has, given the correct medicines, and my daughter is here singing in front of you all. Thank you so much.
No correct medicine, usual medicine, all of them will learn. Thank you for coming. Give them begin. So, this was a patient of bronchial allergy, and although most of the doctors give multiple drugs, nothing is required except the rescue course. You give a proper rescue course, and then she should continue inhalers for a few months, maybe 6 months, 1 year, and that's the treatment.